Have you ever heard of someone eating their own hair? It sounds strange, but for some people it is a real and serious problem. This behavior can lead to a rare but dangerous condition known as Rapunzel Syndrome. But what exactly is Rapunzel Syndrome and how does it affect those who suffer from it? In this video, we explore the causes, symptoms, and treatments for this disorder, as well as tell the story of a little girl whose life was almost taken by this condition. Rapunzel syndrome is a rare condition that results from a compulsive behavior known as trichophagia, or eating one's own hair. Over time, this hair can accumulate in the stomach and intestines, forming a hairball or trichobezoar, which can lead to serious health complications. The syndrome is named after the fairy tale character, Rapunzel, who is famous for her extraordinarily long hair, a symbol of the large amount of hair involved in the formation of the bezoar. Hair is made of keratin, a protein that the human body cannot digest. When a person ingests hair, it is not broken down in the stomach like food. Instead, it clumps together, forming a solid mass. The more hair that is ingested, the larger the mass grows, sometimes completely filling the stomach and even extending into the small intestine. Let us look at the real-life example of Sophia, a little girl whose experience highlights the dangers of this condition. Sophia had developed the habit of pulling out and eating her hair. For 8 weeks, she seemed to have stopped, but unbeknownst to her parents, she had secretly started again. One morning in December, her mother woke up to hear her crying and saying that she felt like she was going to die. Sophia was vomiting and shortly thereafter passed out. Her parents rushed her to the emergency room. When doctors examined her, they discovered something shocking. A mass of hair had formed in Sophia's stomach. It was so large that it had started causing ulcers and had even created a hole in the stomach wall. Without immediate medical attention, her condition could have degenerated into sepsis, a life-threatening infection. Fortunately, doctors were able to surgically remove the mass of hair, and Sophia has made a full recovery. Her case is a clear example of how dangerous Rapunzel syndrome can be if left untreated. Trichotillomania often begins as a response to negative emotions such as stress, anxiety, or frustration. Hair pulling becomes a coping mechanism to deal with these unpleasant feelings. In some cases, trichotillomania is followed by trichophagia, with individuals eating their hair as part of the compulsion. Rapunzel syndrome does not develop overnight. It usually progresses over time with continued ingestion of hair. Symptoms can often go unnoticed until the mass of hair is large enough to cause serious problems. Common symptoms include severe abdominal pain, nausea, vomiting, and bloating. Other signs may include loss of appetite, weight loss, and bad breath due to decaying hair in the stomach. If left untreated, hairballs can cause life-threatening complications. These include intestinal obstruction, which prevents food from passing through the digestive system, and perforation of the stomach or intestines, where the trichobezoar tears the walls of the organs. This can lead to infections such as peritonitis or sepsis, both of which are potentially fatal if not treated promptly. Some experts suggest that neurobiological factors may also play a role. Imbalances in neurotransmitters, particularly serotonin and dopamine, may contribute to the compulsive behaviors seen in trichotillomania and trichophagia. Diagnosing Rapunzel syndrome usually requires a combination of physical examination, patient history, and imaging tests such as ultrasound or CT scan to identify the presence of a trichobezoar. Once diagnosed, treatment depends on the severity of the condition. In cases where the hair mass is small, it can be broken up with a laser or removed via endoscopy, a non-invasive procedure in which a tube is inserted into the stomach through the mouth. However, larger masses usually require surgical removal, as was the case with Sophia. Although surgery may resolve the immediate physical problem, it is critical to address the underlying compulsive behavior to prevent a recurrence. Cognitive behavioral therapy, CBT, is commonly used to help patients manage the urges that lead to hair pulling and eating. With that said, if you enjoyed the video, please like and subscribe to the channel to stay up to date. Thanks, and until next time.